There you go, nice.
Have you had that kind of done before?
No.
Okay. Fail.
Well, he's not a man of many words.
I just didn't want to get it like, oh, I'm really suffering here, but I'm not going to say anything.
No.
We're good balance together. Ed's a man of too many words. This is good.
Lower back, my L4, L5.
Okay.
Feels like my hips are being crushed at night when I sleep, and then my neck.
Does it go down the legs?
Yeah, my right leg normally, but my left blade, like this whole week, has been going numb. So
Where exactly? Can you point?
Like my leg. I mean, I just can't feel my leg.
The whole left leg?
Yeah, it just goes away. Usually it's my right leg.
And on the right leg, is it usually the whole leg or part of the leg?
Yeah, it'll go like 2 days at a time sometimes without feeling it.
And that started all when?
14 years ago or so.
Okay, so on and off it goes numb, comes back, and then worse. What time of the day would you say it's worse? You wake up with it numb? Do you go to bed?
No, that's more during the day while I'm working. At night when I sleep is when it feels like somebody's like crushing my hips together.
Okay.
But
And that's been, was there an injury back then, or it just sort of came on slowly?
I used to do plumbing, and I was just moving a shoe rack in a garage it was like less than a pound, and I just twisted and it laid me on the ground, and I couldn't move. And then they started doing like
They had to lift
MRIs
you
and
somewhere and
stuff.
take you, okay,
Yeah.
they took MRIs of your lower back, saw disc injuries?
Yeah, they said degenerative disc disease
And that was-
whatever else. Then they wanted to fuse my back, and I wouldn't
Uh-huh.
let them. And then I started going to chiropractor,
Okay.
like 3 times a week. That's
Okay.
what I started, and then gradually went out.
All right, so let's say late 20s, that injury happens. You're under chiropractic care since then, or
Yeah.
and give me as best as you can. I know it's hard as a patient, going exactly what's going on, but what do you think the focus of the chiropractic care that you've been under? What's their focus on when they're working on you? Where are they focusing the treatment on?
I don't even know. Lower back, maybe.
On the lower back.
Yeah.
Do they talk about posture at all? They talk about alignment? Not so much. Okay.
No, not really.
Just curious, but get an idea of what they talk
I mean,
about.
like years ago, the other chiropractor went through all of it and like explained it, but like the one we've been going to hasn't.
Okay. Do they have anything at home that they tell you to do? Is there any?
Yeah, we have like all the different neck pillows and all that stuff to lay on. We have all that.
So you have like a dental roll or just?
Yeah, well, we have just about all that.
Do you have this guy?
We have just about everything they sell for necks and backs and everything.
Do you have this guy
Yeah.
specifically?
Yeah.
Mhm.
Okay. So they explain this is called the lumbar dental roll, and how do you lay on this? How would you typically lay on this, and what's your procedure?
And my neck.
You have the neck one.
Yeah.
Okay, but do you do one on the back?
No, I usually use a roller if I do it on my back.
Okay. And where do you place that roller? I'm just curious.
Like in here.
On the lower back.
Yeah.
Okay.
To try and
And your
stretch
tennis
it.
ball.
And then I have a tennis ball, so I actually sleep on a tennis ball a lot of times, just
Okay.
to put pressure on. So a lot of nights I can't sleep, and I'll go downstairs and put my leg on the back of the couch, just to elevate it.
Yeah.
And it's just like, I don't know, then I can finally sleep.
There are 24 vertebrae in here, 24 bones, 23 discs, and the two that you're talking about that cause those symptoms are these last two at the
L4,
lower
L5.
L4, L5. You've heard that over and over again. They always pick on those guys.
And the last time I went, they started talking about my neck, saying that it was starting to go bad up there.
Okay.
But yeah, but I don't remember what.
Cervical 5, 6, and 7 are the ones in the neck that typically go, and L4 and L5 in the lower back are where 99% of disc injuries happen. And I was going to ask you a question. Well, why did these discs get injured? But they didn't show you, or maybe they didn't bring up the fact that the other discs in your spine are not injured. Maybe they didn't talk about that.
No,
That's what I would focus on. See, my focus would be to show you that L1 and L2 and L3, these discs up here, don't harbor any injuries, and that all your injuries are contained at L4 and L5. And they use the word degeneration, and they use the word wear and tear and aging, and I go, well, how old are the other discs in your spine that are not injured?
Right, the same age.
They're all the same age. So how can we say it's wear and tear when all the discs in our spine are the same age? Well, the alignment and mobility of your spine determines where the stresses go. So if your spine, for instance, is supposed to have a curve in it, and the curve allows the weight to be evenly distributed over all the segments, and if we sit and bend forward and rotate and spend a majority of our life bent forward, we lose this curve, and when something is straight, where does all the weight go?
Into the disc.
Right to the bottom. It gets transferred to the bottom of your back. And so this area is if we took a motion x-ray, what we see predominantly is that all the bending happens down here. That's what's grinding these teeth. Like if I only chewed on a few teeth in my mouth, I'm only chewing on this side, so these teeth are getting worn down, but I'm not chewing over here, and these all look brand new. And everybody's focusing on the worn out teeth, and I'm going, well, yeah, that's the only part of his back that works. And then we get into this real tragic scenario that you've been going through where they're telling you to put the thing on it. You're putting the rollers on it, you're putting the treatments on it, and they're adjusting it, and they're making it looser, right? It's hypermobility that injured it in the first place. And somebody might say to you, well, but your hips are unlevel. Well, you're right, you're dang right his hips are unlevel. He's in pain. He's got numbness going down both his legs. What is that? Hopefully they explain to you what the numbness is. The numbness comes from these nerves getting hit, right? We have discs hitting nerves, and the nerves are no longer able to send information about your leg to your brain. So these wires are being pinched by space-occupying lesions or disc herniations, bone spurs at these two levels of the bottom, okay? The hips are unlevel because when I tilt, so if I raise this left hip, watch the size of these holes on that other side, they get bigger. Do you see that? Right? So if I'm pinching a nerve on my right leg, my body will intelligently and purposefully do this to take the stress off. And that's what you said earlier. It was going down my right leg, and now it's going down my left leg. Did anybody explain why that's happening? Well, no, not really. That's called compensation. Your body, so this hole got bigger on the right, but what did it do to the left side? It made the left side smaller, right? So in a desire, in an intelligent scenario, your body's trying to move the hot potato. Something's burning my hand, so I'm going to move it around. That's the effect of having something hot in my hands. There's something hitting nerves in your lower back, and of course your body's going to be compensating. You follow me? Mm-hmm. I'm in pain. I have symptoms. You're going to be in avoidance. Nobody's bringing up the fact that part of your spine is not aging. This part's doing all the aging, and heaven forbid somebody take your left hip and shove it back down, and we pinch the nerve again. Right? If your left hip is high because it's trying to avoid a nerve on the right side, we don't want to touch those hips heights. We don't want to adjust your hips in the sense of trying to. Go ahead, please.
Like in class.
Please, go ahead. No.
She's my medical
Please.
person.
Go ahead, please.
Okay, so would that be what, so like sometimes when he gets adjusted, he's like, it's worse.
You're gonna get worse. Well, this
And I'm
treatment,
like,
everything I've heard
that's
about
not a
here,
thing.
I'm hiding my horrification, but I'm horrified of what I'm hearing.
Okay.
We need to leave his lower back alone. My dad was injured by chiropractors manipulating his lower back over and over again. We gotta stop that. It's like a worn out tooth that's, you're worn it down, and we gotta leave that tooth, we gotta stop chewing on it. We need to teach him, we're gonna place the dental up here in your middle back. Leave that lower back completely alone. We're going up here, and we're gonna transfer and divert stress to the areas of your spine that are not injured, that I can show you on your MRI if you bring in another visit. I'll show you how healthy and young the other same aged discs in your spine are, right? That nobody talked about, that the fact that I would say 80% of your spine is young, 18 years old, and 20% of your back is 80 years old. And do you want to keep using the 80-year-old part of your back, or do you want to use the 20-year-old part? And this is where I can try to show patients, your middle back should feel supple. Can you feel, right? If it's all tight, see how it's not bending?
Oh, yeah.
Right? Where's all my bending happening? Well, down at the bottom, right? So we got to get your middle back unlocked. Do you follow me? Mm-hmm. So you have your whole spine working as a team. And stop manipulating the lower back. They think of it, chiropractors will usually say, well, the bones are, maybe you heard this word, subluxated. The bone is out of position, it's subluxated, and that's the purpose of chiropractic. I'm not sure if they told you that. The purpose of chiropractic is, I'm going to take x-rays and to see where your bones are crooked, and then if your bone's crooked that way, I'm going to uncrooked it, and if the hips are crooked, we're going to uncrooked your hips, right? I'm going to adjust your subluxations, and maybe that's what they've told you.
Yeah. Which is why she said I get headaches, is because it's where it's supposed to be when they put it there, and it's causing all the pain is when they adjust it.
All right.
And then my neck is a whole nother thing. Like I get horrible headaches like within 2 hours again, adjust it.
I got you, bud. First of all, there's no adjustment that can permanently change the position of a bone. If they told you that, they don't know what they're talking about. You cannot change the bone, any bone, permanently through adjustments. The body has ligaments that wrap the vertebrae and they determine the posture of the spine. We have to use stretching to change the position of your bones. If, again, we're going back to that disc injury. If there's a disc injury over here and your body compensates, why would I want to throw the body back into the area that my body's avoiding? If I break my right ankle and I shift my weight to my left ankle to get away from my broken ankle, should I throw my weight back on the broken ankle?
Right.
I'm just going to hurt my broken ankle more, right? We need to repair the broken ankle. When I'm no longer injured, my body will resume using something that used to be injured, right? So they believe the bones are crooked and that's what's making them hurt. I believe, no, we hurt and we become crooked as a result. Exact opposite. You catch me? The crookedness, the subluxation is the result of having the wrong alignment, having the wrong mobility, certain vertebrae being injured, and then your body becomes crooked as a result.
The past 6 months, if I go get like a rough massage, like at the mall where they like dig their elbows and stuff in my neck, I can't see for like 15 minutes afterwards. Like I can't drive straight home because I can't see. And then I get like a crazy headache. I eventually just told them not to massage, like dig into my shoulders and my neck because of it.
Yeah. So there are 3 segments in your neck that I'm, again, without a picture, I can't completely tell you, but I would surmise that the lower neck is injured, just like your lower back is injured. These two areas mirror themselves. And so anytime any treatment is done on those areas, we're going to be sticking our finger into it. If you have a cut on your skin, I go sticking my finger in the wound. I felt worse afterwards. Yeah, sounds about right. And I would be a little hesitant having a cut. You have a cut. You need to understand these MRIs show cuts. You have wounds. There are wounds internal in your body. And nobody needs to be sticking their finger in them, making them worse. And you're right, you're getting worse. We need to leave your lower neck alone. There can be inflammation, for instance, in the upper neck. So if this area is overstressed, it usually indicates that the upper neck, the main engine, must be not working. If this main engine is all rusted and frozen and...
That's where my headaches start.
Right. So this area is all clogged up. When we go in there and work it loose, it can stir it up a little bit, and you might have a little bit of, uncomfortableness in the upper neck for a short period of time as we clean it up.
Love is different.
Headaches specifically come
Different
from
areas.
inflammation in the upper cervical. We call them cervicogenic headaches. They're coupled with posture, so the more forward our head goes, the tighter the muscles are in my neck, right? So if we're not doing something to reduce your forward head posture, headaches will always rebuild back up again, right? Because the posture creates the tension. If I hold a bowling ball out in front of me, my muscles work harder than if the ball is close to my body, right? The weight of the bowling ball is not changing. It's just where I'm holding it, right? That's posture, right? So if my head's forward for a majority of my day, at the end of the day, I'm going to have a lot of lactic acid buildup in my neck from, if I hold this bowling ball, my muscles are really sore. Well, yeah, you were holding this ball here all day long, and then at the nighttime, your body's trying to clean it out, and you feel then the headache. And the more forward your head goes from your shoulder, the more constant tension you're going to hold forever and ever. And this is where I'd hope the chiropractors are talking about, we got to get your ear over your shoulder.
Oh, they've never looked at that.
Okay, well, then we're never going to correct the problem. You understand? If that's the goal, you understand, like if you were in my office for a few months, we need to change that. Like, how are we doing? Are we lining these things up? I'm accountable to, are you doing your stretches? You understand, you're doing them properly, and we're getting care, so your wife sees, yeah, I'm seeing your head come back, and as your head starts to come back, I don't have headaches anymore. Those two things are directly connected together. The head coming back also will stop the lower neck from aging, and then symptoms of radiculitis down your arms.
My arms go numb a lot, especially at night.
That's because his lower neck is worn out. So we have a worn out lower neck, a clogged upper neck, I'm sure a clogged middle back, a worn out lower back. We got work to do. And the answer is to not manipulate the lower neck. It's easy to loosen, again, the parts that are already loose, right? And I have no confidence that in his care that the focus has been on the areas that don't need to be worked on, right? You understand? Worked on the upper neck and the upper back. We're going to have to just run a test today and see how your body responds. But know that I've been trained to leave your lower neck alone. It might feel odd. I'm very curious to see how you feel the difference today from what you've been through. It might feel odd, but again, what is the definition of insanity? Doing the same thing over and over again, expecting a different result, right? And well, your treatment was different than his. Well, we're going to try something different here today. All right, and we're doing about 2 inches forward from his ear. Okay, easily 2 inches. Okay. Left shoulder's low. Your body's trying to get away from this left side. Body's tilted.
He's a lefty.
Right hip is high. They tell you that? They just say right hip's high?
Yeah, I think
Got a quarter inch. So you're in.
so. My right leg's normally shorter than my left leg.
Correct,
So I guess
yeah.
That's one thing
That
I
would,
ever check.
that would make that right leg look short. That makes sense because the right hip's high. So, and you're having symptom mainly, you're saying both legs, but mainly left leg today?
Lately, it's been the left leg, but like for years and years, my right leg just randomly will go numb for
Okay.
like 2 to 3 days at a time. She yells at me going up the stairs, and I'm stomping my feet, but I can't feel my feet even hitting the steps, so I don't know.
I'm gonna start working on you. I'm horrified about what I've been hearing.
Okay.
I'm gonna start working on you.
Yeah.
I'm on your back for me. On your back for me, bud. All right. Yep.
Well,
Yep, good. I'm gonna help you, bud. A little step for me. Help me. Deep breath in for me. Let your chest relax. Exhale. Let it go. Here we go. Most important one right here. Yeah, really tight. Deep breath. I got you, bud. Exhale. Let it go. Let it go. Deep breath in for me. Exhale. All right. Take a breath. Take a breath. Take a breath. Have you had that kind of done before?
no.
Okay. Fail. That's not good. That's not good. That's almost everything I do till from now till the end of the visit is to make the next.
fail, chiropractors fail.
Not you. No, I'm not talking about you. I'm talking about the chiropractic treatment. If they haven't been doing that,
I've
to you,
never had that done, ever.
or
I've been to probably 6 chiropractors.
okay. This tightness is your problem. His middle back, you felt my middle back, right? It's supposed to be butter in there. Your chest weighs, I don't know, 80 pounds, I weigh 180. We put 200 and something pounds of force into his middle back. And they moved, but boy, they were like resistant. Do you understand?
Mm-hmm.
Should be butter in there. You understand? They should be easily moving joints. The tightness of your middle back is the reason for why mechanically your poor lower back is overworked. And so I'm going to leave that lower back. I'll check it out after I work on the hips a little bit, but I'm going to leave the lower back alone. The goal with the side posture, if you're wondering why we do the side posture adjustment, right? They put you on the side and they twist you, right? They do that a lot?
Yeah.
Okay.
It's like
Every
all
time.
they
That's all they did, right? Everybody wants to.
But it don't move really ever.
Okay. The goal of that adjustment is to adjust, well, it should be to adjust the SI joint. The joint between your ilium means wing, and the sacrum means sacred. I don't know, in biblical times you put your hand over the guy's sacrum and don't invade my land. I don't know. It's called the sacred bone, okay? Sacred
We're going with
bone,
it.
wing bone, okay? Wing or ilium. Sacroiliac is the joint between these two structures, okay? This joint never has surgery. We never have operations, it never wears out. It's one of your like heavyweight fighters. Everybody has surgery on these last two guys in the lower back. The lack of functionality of this joint promotes destruction of these two joints. So the purpose of the SI joint, the side posture adjustment, is to loosen this joint. You follow me? Now, I don't know if they're even adjusting that joint. They could be putting their hands in your lower back and actually trying to adjust your lower back, which would be really, really bad, right? Depending on where they're contacting, right? I'll show you that when I put my hand on your back in a second, but nobody should ever contact your lower back and try to push on the lower back on a side posture adjustment. Again, I'm not there when they got adjusted yet. I don't know what's happening. I'm just saying, just giving you information. Right. Nobody should do that ever, having you on your side. The goal is to adjust the SI joint below the lower back, okay? We can't adjust the SI joint if at the cost of injuring your lower back. Does that make sense?
Yeah.
Okay. All right. Wow. Everything's blown out to the right here.
Said wow.
Everything's blown out to the right. Nothing is where it's supposed to be. All right. I'm just gonna massage. Just take a little bit of oil. I got you, bud. Not gonna hurt you. One of my favorite things is, why do chiropractors call themselves doctors? Well, you got me right. I'll be wondering why other chiropractors call themselves doctors, because you're supposed to learn something. The word doctor means teacher. You're supposed to come in here and learn something, and how the body works. Like I said, we don't have a heart that pumps our sewer pipes. Why? That's a great question. I don't have the answer for you for why. It's the first question I get to God up there. And no heart lymphatic, no pump, no heart for the lymphatics? I'll be first in line to ask that. I don't know why we don't have a heart that
You'll be
pumps.
the only one in line to ask that.
I don't,
My first chiropractor explained a bit like 15 years ago, but
Okay. I don't know why the enamel doesn't replace. I don't know why we don't make new brain cells. I don't have the answers for you. It's just we don't. So we're gonna have to just deal with it. If you crack a tooth, right, that cracked tooth isn't gonna come back. I don't know why. Why? Alligators get unlimited teeth, sharks have rows of teeth, humans 2 sets. I don't know. It's the rules that we're under. Oh, that's just crazy, Dr. Ed. No, I regrow my teeth. You do? Do you really? We don't make new teeth. So we're gonna have to, these discs in his spine don't regrow either. They can be rehydrated, they can be cleaned, but we've got to make his disc last another 50 years.
they wouldn't diffuse them.
Which, all right.
Which I didn't know. But
All right, so you have a room in your house that's got broken glass, a broken TV, and a bunch of soiled diapers in it. What should we do? Should we bolt the door shut and lock it and let nobody ever in that room again? Fixed it, done, all done, right? Or should we go in there and remodel it? Does that make sense?
Mhm.
And try to repair the reasons for why there's something in there that people are trying to avoid. You know, I'm not an avoidance doctor. We got to confront the monsters in our spine, not fuse them and then shift the problem an inch or two above or below. We're not dealing with the root cause. We're kicking the can down the road with that.
You're making me fall asleep.
Good, okay.
I love this stuff.
All right, but so when you're, I have to ask more specific questions. When you're being massaged, are people focusing up here? I'm curious. Where's the
no,
focus?
Not really.
Not really?
My lower back, like.
The lower back's the
here.
focus.
Yeah.
Okay, all right.
When they do, like,
Okay.
where you are a little bit.
Little bit.
If they do it like really rough, like in my neck, that's when I can't
Headache.
see.
All right, well,
Is your face pushed into like a thing too?
Yeah. Mhm.
it might be just the pressure on his eyes, you know, could be.
Sometimes when you're face down and the pressure, it's like you come up and you're like,
Yeah,
"Bitch,
yeah,
in the
that
last
could be it.
15 minutes,
All right,
you know?
well,
He's a mess.
I just tell them not to touch my neck,
Well,
but that's fine.
I'm not a car mechanic. I'm trusting my car mechanic to give me proper advice, right? You guys aren't doctors, that's okay. But you're going to doctors, you're seeking help, and we're being led into the wilderness, just lost, walking around in the woods. Where am I? What's our goal here? That's why I asked, what are we doing? Why are we going to chiropractic? What's the purpose? Just crack bones and yay, that felt nice. Is that why we do this?
It's the very so what we hear with we've been to multiple chiropractors, but it's like, okay, you know, you need to come back for maintenance. And then it's, if there's any level of complaint, it's like, well, yeah, because we're only seeing you whenever it is.
My-
You know? And it's like, well, if you came, okay, so what do you recommend? Well, if you came once a week or if you came every other week, you know, we could speed up the progression.
Okay. So there's the idea that they would even use the term maintenance is laughable. I don't want to maintain this. We're not in a position of maintenance. We're in a position of correction. We need to correct the problems that I'm seeing, and then we could even, a year from now, talk about maintenance. You understand? When he has no numbness down his legs, and he has no numbness going down, and no pain and headaches, I don't want to maintain that. We're maintaining the wrong thing here. His posture's wrong. He has disc injuries in his lower back and his lower neck. Do we want to maintain this trajectory? I don't want to. I want to get off this. I'm abandoning this ship. I want to get onto a path where his lower neck stops aging, his lower back stops aging, and we start utilizing the other parts of his spine that are young. And he'll feel younger when the younger parts of his spine start to work. Adjustments cannot change where your body likes to bend permanently, maybe for a few hours, but it's a very, very short time where just adjusting the spine is going to make him feel better. We're not changing his alignment. We're not getting his ear over his shoulders by adjusting his neck. And so you have the dental, but I think our utilization might be a little improper. I'm going to check that at the end and how he uses his stretching. It should feel like this, really. Do you understand?
Mhm.
When you're on the neck dental, it should emulate what I'm doing to his neck right now with my hand. You're trying to emulate or maintain what I'm doing, which is holding your neck in this curved position. How's that feel? You okay?
Mm-hmm.
Okay. We want to be stressing the body to get it to change, but I'm not here to overwhelm you and cripple you. Do you understand? It's like riding a surfboard. Too far forward, we fall off that way. Too far back, I fall off that way. We're trying to balance on this board, this surfboard here, in cleaning his spine without overwhelming him. And I hear some overwhelming, or they're working on you where you're injured. So they're either adjusting him where he's injured, or they're simply working on them too aggressive in these areas that are frozen, and then it's boiling, it's just so much. I don't know.
I don't know either.
That's okay. I'll just fix you. I'll be quiet now.
No, you're fine. I'm just taking a nap.
Just fix it.
We're learning a lot, it's great.
I'm gonna start with this right side. I'm not gonna hurt you, I promise. I got you. It's okay. Let me hold your head. I got you. Oh, easy. Wow. Okay. All right. Relax. 1 second. I got you. Wow, it's tight up here. Wow. All right. I need you to try your best to compare and contrast what we just did with what you've been through.
It was nothing.
You're not.
I mean, I've never felt like that before.
Okay.
I don't think they ever adjusted up that high before.
He always wants,
Gotcha.
He's like, I want somebody to take my head and pull my head as hard as they can and pull my feet and like,
All right. I hope everybody's heard what he said. I don't think everybody's adjusted that high on his neck before. Do you understand?
Right.
He felt my hand right off your occiput, right? I'm right up here as high as I can. This is bone. This is solid bone here. I can't adjust your skull, right? So the first bone is tucked up underneath your occiput here. It's called the atlas, okay? So when I'm adjusting you, my hand is about as high as I can on your neck. If they've been putting your hand, maybe they've been going down here. Does that make sense? Okay, so you're used to having the hand in the lower neck, adjusting the segments that are injured. And I'm going back to my skin cut analogy.
I felt it in my left eye the first time you did.
Right. But do you see my point? If you have a cut on your skin, we need to stop poking it. He has wounds in his lower neck that can only get better by them being put on vacation. And that needs to be understood by everybody. If we don't loosen the upper neck, right, and then we loosen the lower neck more, and then we put them on a neck dental, it's very possible that the dental is only making the loose areas bend more, which could be hurting him. Very depressing places. So you shouldn't be stretching them, right? The goal is to unlock the parts of his spine that are frozen so that when we're stretching, only those frozen areas are doing a majority of the bending, and we're not bending where he's injured. You follow me, right? And that should benefit you. That should help balance you. If I let you feel my upper neck is butter, just like my middle back. It's supposed to be just no restriction up here. An absolute effortlessness. There's no discs between the skull and atlas and between atlas and axis. The top two vertebrae up there, there's nothing to restrict mobility. 60% of the work of your neck is designed to happen at the atlantoaxial and the atlantooccipital joints. The upper neck is supposed to be your main engine. It shouldn't feel like a blockades in here. So his poor backup engine, his lower neck, is doing all the work, and it can't take it anymore. 40-something years old, it's done. He's worn it out, but we got to live another 50 years, or 40, 50 years, and so we got a long way to go, and it's not going to, the trajectory of maintenance, do you want to maintain this mobility pattern? I don't feel, his body's not bending at all properly where it's supposed to be bending, and so all we're going to do is further age the parts of his spine that are already worn out. If my dad walked in, it would make more sense. I don't know what I know because of my own revelation or my own teaching. What I know is through a chiropractor that has had to live this, be injured by it, and figure out what to do to fix himself. Okay? So it's not so much the fault, I know I'm picking on these other chiropractors, but they haven't lived 40 years of being a chiropractor like my dad, and then him transferring that to me and going, Ed, leave it alone. It can't be helped. Because they told me to adjust your lower back. They told me to adjust your lower neck. I go to the seminars and they tell people to do it. So I'm not surprised. I'm just telling you that it doesn't work. It does maybe a very short-term benefit, but long-term, all we're doing is further imbalancing the mechanics of your spine. Up here, we need to leave your poor lower back alone. And I take it nobody's probably rubbed it here, right? Nobody's digging real hard in here. Not really, yeah.
Up a little bit higher. There's a knot.
Yeah, right in here, correct. This rest of our visit, I told you at the beginning, is to make the next time I adjust you in here better. Wow. The stretching is to try to emulate what I'm doing right here. You follow me? We're going to put that right in here, and just hold pressure. Now, it should just be uncomfortable where I'm pressing. If we press here with a roller or a stretch on your back and it starts to hurt this or hurt down the leg, we got to get off or move higher or elevate the head, make the stretch less intense. We can't just push through that. I don't want to aggravate your lower back more. I was 14, 15 years old. My dad taught me how to start working right there.
I don't think anybody ever touches there.
Yep, this is where your diaphragm attaches. I gave you a clue to one of my questions I'm about to ask you, which is there are two muscles in your body that never get a vacation. First one is your heart, right? Because when can your heart get a break? In between beats maybe, but from the day you're born to the day you die, your heart has to keep beating, right? There's another muscle that doesn't ever get to have a break. Has to work, like your bicep gets a break, right? When you're laying down, right? This bicep isn't contracting all night long. Your tricep isn't, right? Your hamstrings aren't, right? But there's a skeletal muscle in your body that doesn't get a break all night. Your diaphragm, right? Unless you're gonna stop breathing all night. do you follow me? Right?
Yeah.
So your diaphragm muscle never gets to just take a vacation. And where does your diaphragm attach? Very good question. T12, right here. And so it locks this part of your back. It has to use this as an anchor point so it can move. And so this part of your back becomes frozen. And then when you're bending, all the bending happens
Lower.
at the lower. You got it. So we need to daily talk to our middle back and say, hey, you got what you need? Don't quit on me. I need you mechanically participating with this team.
I usually just cuss out my lower back.
Say that again.
I usually just cuss out my lower
Cuss out your lower back. Okay, I got you.
Very productive.
All right. The best analogy to understand this is the whipping boy in England 500 years ago. Maybe you've heard of the whipping boy? No? The prince was not allowed to be spanked. They considered the prince and the king to be like deities, and so they couldn't spank the prince. And so they came up with a solution to disciplining him. They grabbed a peasant kid from the local town and they had him live in the palace, and he most likely became a knight, became close friends with the prince, but if the prince did anything wrong, they beat him up. Right? He got spanked and injured for the sins of the prince. That's what's happening in your back. This guy pays for this guy's problems. Your middle back's not working, and your lower back got whipped for it. And everybody's looking at your lower back going, oh my gosh, it's so diseased looking. It's got bone spurs and disc herniations. I'm like, yeah, but it didn't do anything wrong. It paid for the sins of another part of your back not doing what it's supposed to be doing. Your lower back had to take the extra burden that your middle back was supposed to be handling. So I'm going to just to reiterate, nobody's digging in here, right? Is that correct? Okay, good. We're not going to be insane people. We're not going to keep doing the same thing over and over again. Right there, it's just all blockaded. All right.
Right there they do.
Right, these are just the roots of your neck, right? So we got to push down these roots.
Once they feel that knot right there, they
Correct.
dig into it.
I understand, but digging into the knot isn't going to change the reason why the knot's there. We're digging into it to try to clean the spine so that your stretching can be effective. All right.
Kids are meant to move, not sit.
That's right. That's right. That's why they're homeschooled. So
Yeah, we homeschool too. So, yep.
I was homeschooled, if you couldn't tell. Exactly.
Really?
One of those weirdos.
Yeah. Whatever. We're all embracing our weird.
That's right.
your body responding to this stuff?
Fine.
You doing okay?
Yeah, I don't really feel much.
Okay, good. I just want to make sure it's not like.
He's not a man of many words.
I just didn't want to get it like, oh, I'm really suffering here, but I'm not going to say anything.
No.
We're good balance together. Ed's a man of too many words. This is good. So that's what this tool was primarily used for, was for lymphatic fascia, you mentioned.
I think we have one.
Yeah, we do.
We're trying to promote and increase circulation through the soft tissue to remedy the problem, which is there's no heart that pumps our sewer pipes. You do not have a pump. So if this stays in contraction mode, nothing's going to get through. It's got to relax and then contract, and then relax and contract. That's the pumping action. We call it imbibition, is the fancy word. It imbibes fluid into itself through movement. Joint muscle contraction, relaxation is what creates the flushing. Okay. Has anybody worked in this area?
Massaging. That's
Okay.
That's usually where I put the tennis ball when I sleep.
Okay.
Right there, actually.
Yeah. All right. The bigger the gym workout, the more sore the next day you are, right? So I want to just do a medium pass on everything and see how it happens. I don't need to be upsetting him worse. I left your office and it was shooting. I'm like, oh great. I don't want to be. Let's just see what a nice cleaning going in here and just cleaning this up a little bit. I'm diverting stress off your lower back. Let's try to get the pressure off L5 and L4, and let's just see what happens. It'll get better just by being left alone. What in the world is that? Oh, man. All right.
If I took my belt off.
It's okay, you're fine, I got it. I can feel it. Right there. Okay. There you go, nice. That was it. That bone hasn't moved in a while, right? I don't think so. You probably couldn't even hear it. I doubt anybody could actually hear it. I felt it, but it went like this. It went. It didn't do like a nice crisp click. It went like a rusted. It's like it moved, but there was some sludge in there. That was not a normal. It will, as we work on it more, it will move more crisp in a future visit, but it'll sound more normal. That just hasn't moved in a while. Okay.
We'll be like, sludge is not a professional term.
He's not a doctor. Correct, I'm not a medical doctor. I never professed to be a medical doctor. I'm a doctor of chiropractic.
When did MDs become the only doctors?
You guys have, like, I was talking to Eddie about this. You guys have an absurd amount of internet trolls on your social media.
Right.
Yeah,
Like,
Right. Yeah. Got it. Okay. Okay. You all right, bud?
Mhm.
All right, let's go on your side either way. I'm gonna just modify. I want to show you a reason why. I want that arch in your back. Because your lower back's supposed to have a curve in it. Does that make sense?
Mhm.
So I don't want to be, when I'm adjusting you, bringing your leg up high. See how that flattens this out? Right? I just got done telling you how important it is for that area to be curved. Why do I want to be adjusting you with it straight? You follow me? I want this to have a curve in it. So we let that, you kind of like let your butt stick out and let that be swayed down here. That make sense? All right, I'm just gonna feel how the middle back is here. I got you, exhale. All right. Again, I don't want anybody ever touching your lower back. Nobody ever puts their hand, do you understand? Down here in the lower back. If that's happening, you gotta get out the door. I don't tell you. Nobody touches this. Nobody touches this, okay? I'm just saying, we're adjusting the SI joint down in your pants here, down your glute. Breathe for me, I got you. Exhale, easy, easy. Yeah, you just, okay, good, good. Get the idea, right? Feel that move down there, other side. And then down here, I got you. Good, it's okay, all right. All right. Okay. Okay, good. Okay, good, okay. All right, 1 second. Good, good, yep. Good. There we go, okay. Is yours gray like this or is it white?
Black.
All right, we're at the, it might not be this, the Den Roll, they have off-market, off-brand versions, so it might be a similar one. My question is the height of it.
It's adjustable.
It's a, yeah, the.
Okay, good,
pieces
good. I think I know the one you're using. It's okay. The goal is I don't want it pushing his head forward. So notice like right now there's maybe about a hand's breadth behind his head. I don't want it so high that his head is like inches off the ground. I showed him how to get on it. You place it in middle upper neck, you press your head into it. This would be the proper size for him. If this version is a little taller, this would not be good for him because it'd be pushing his head forward. Now he would outgrow this, or he should outgrow this. If I show you my neck on this, my back of my head touches the ground.
That's what I was just gonna ask. What
So,
if his head's touching the ground? Not
Then you have to go to a taller
size.
size. Then you have to go to
Yeah, go ahead.
he pushed his head into it. We're trying to press it into the mold and then do 20 minutes.
20 minutes, okay.
20 minutes, did they tell you, how much time were you doing it on? 2 minutes, 5 minutes, 3 minutes?
Like 5.
Yeah,
Okay.
he probably does 5.
Okay, so it's okay. I'm just curious, seeing where we're starting here. 5 minutes will never change posture. 5 minutes is not bad insofar as it helps us get to 20 minutes, okay? Now, I don't blame you. If you do 5 minutes and all of a sudden you have a headache, I wouldn't want to do it either. So we could start at 5 minutes, see how you do, and then just get off. It shouldn't be causing headaches. If it's causing headaches, you need to get adjusted again. And again, this is not, you might be here 3 times a week because we're in corrective mode, getting to a place where you can actually use these instruments to be in a maintenance mode. Do you follow me? When you can then maintain your own care at home with your water pick and your floss and your toothbrush, now you're in maintenance. He's got cavities, he's got bleeding gums. We're not in maintenance here. We have to correct his problems, and then we can even think about the word maintenance.
Sure.
We have, like I said, these cysts and all these are all just extraneous things that are happening because of the mobility not being proper. Because he works hard, he's been working hard for many years, and his chest, the environment that he's in makes his chest very stiff, and then all the work gets sent to these other areas. And that's all that's happening. There's nothing, he doesn't have a disease. They call it degenerative disc disease. I know that's what they told you.
Mm-hmm.
He does not have a disease process. It's not a disease for a piece of bacon to go from soft and flexible to hard and crispy, right? You just burn the crap out of it, right? You just roasted one part of your spine and it got desiccated and dried up, but it's not a disease process. It's been overstressed, and as a result, doesn't look that great. If I get punched in my face every day, my face wouldn't look that great. Doesn't look that great anyway. But keep me in the face.
Yes, it does.
You face, right? Look that great, right? You might come in and go, oh my gosh, Ed, what's wrong with your face? You have a disease? No, every day I get decked in the face, right? Trauma, repetitive trauma is gonna make things not look great. Do you follow me? His poor lower back has been repetitively traumatized, and they're calling it a disease, and no, it's just been abused. Abused and diseased are not the same thing.
Sure.
Okay. Grab your thigh, push,
So how long is he like this?
relax. All
How long
right,
did you do
I'm
this at home?
20 minutes. Everything is in intervals of 20 minutes at whatever he can tolerate.
Okay.
Now, it should be hurting where it's pressing in.
Nothing
right?
hurts. Right?
Okay, hold on, now just roll upwards a little, come towards me, roll, come on. Get the idea?
Mhm.
I want it uncomfortable. You follow me? Where it's pressing in. If the lower back starts getting upset, we have two options. We gotta go higher on his back, or we gotta elevate his head more.
That relieved my lower back.
It will, I know it will. We're gonna take care of, we're shutting it
That's what we
down.
wanna hear.
We're shutting down his lower back. But the middle back somebody else has to take the brunt. Somebody else has to work harder. My hope and prayer is tomorrow morning, Ed, my lower back feels better, my middle back is killing me. Right? You see where we're gonna go? Ed, my middle back's real sore from you beating it up and putting that roller on it. Now a part of my back I've never felt before now is hurting. And my lower back, which is the part that I've been always hurting in, is doing pretty good today. And that's because I can't magically remove physics from your spine. Somebody's gonna have to get punched. Somebody's gotta take the burden of the weight of his torso. But his middle back's just been on vacation, and that's all that's wrong with him. So again, the purpose of the adjustments is I need him 20 minutes on this with no book behind his head.
Okay. In 20 minutes, there's a scientific explanation. He'll
This-
explain it.
When you can do, this rocks.
That looks so uncomfortable.
No. When you can do this, you don't need to be in my office. There is no sciatica. There is no numbness in your legs when this is possible. Your inability to do this is why you're here in my office. You're not in maintenance mode until you're able to do this for 20 minutes. What are you maintaining? You're not, you still can't do it. Can't do this, too much pain.
Oh, he's showing off.
Right? That's maintenance, is when this is easy and you just go, Ed, this is the natural lumbar lordosis. Have you heard the word lordosis before? No? Lordosis? No? Okay. Or curvature. Curve is the English word. It's supposed to be curved down here. It's not supposed to be ortho, straight. Orthodontist, right? Straight teeth, right? Your back shouldn't be ortho.
Can you explain the 20 minutes and why that?
20 minutes is the research time it takes to stretch ligaments. The rubber bands that wrap your spine have a fatigue point, amount of time they have to be stretched and held for them to be permanently lengthened. Right, so think of it like your hamstrings, right? If I was going to stretch my hamstrings, right? If I did this for 5 seconds, have I stretched my hamstrings? No. You have to hold it a little longer than that, right? You have to sit here and hold this for what? A minute, 2 minutes, maybe 3, right? And we used to do Taekwondo, I used to do a full split. We take about 2 or 3 minutes. It's the fatigue point for a muscle. He's not stretching muscles here, we're stretching ligaments. Ligaments fatigue point is 20 minutes. To change the rubber bands, we're not stretching muscles here, we're stretching rubber bands that wrap his spine. Specifically, the anterior longitudinal ligament runs from the front part of your foramen magnum down to your pubic bone is one continuous band that how often does he do that? Never. Right. So that ligament's never been stretched. How often does he do this?
Always.
Well, a lot. So these ligaments are all stretched. You follow me? So when he comes upright, these ligaments are all stretched and these ligaments are all tight. So what's his posture going to be?
Yeah.
Forward. Very fixable. You'll be fine. It isn't easy, but I want to see your MRI. For more information, I need to see your MRI. I need to see how cooked his L5 is. How cooked is the L4? How much tread do we still have down there? And that'll help me with prognosis a little bit. I'm giving you what's this going to look like. I need to see the pictures.